Hi, good afternoon, everyone, and welcome. We're here from the Foundation for Peripheral Neuropathy and presenting our webinar this afternoon, Nutrition for Patients with Peripheral Neuropathy, with our speaker, Barbara Montgomery. I'm Nancy Froman. I'm the Director of Development and Marketing for the Foundation for Peripheral Neuropathy, and I will be moderating the session this afternoon with the help of my colleagues, Tanya and Lindsay as well. And we all welcome you here to this afternoon for what I think will be a very interesting presentation. Today's presentation and webinar is sponsored by Live On Labs, and we thank them very much for their generosity and their support of our programming. And now just a few housekeeping notes before we begin. First of all, this presentation is being recorded. The recording link will be emailed to you so you can view it again at a later time and will be housed on our website for future reference. If you have questions at any time, please feel free to submit them via the questions box on your control panel, and we will try to answer them after the session during our question and answer session. And finally, if you're having trouble with the audio using your computer, you can dial in by phone. If you check your registration email, there'll be dial-in instructions with a phone number there. And now, finally, I'd like to introduce our guest speaker, Barbara Montgomery. Barbara's personal journey to health started in 2011 when she faced several medical issues at a time when she thought she was healthy and close to enjoying life to the fullest, only to find out her body took a different turn. Barb faced her own health issues by learning about healthy living, and she currently has several certifications in health, including being a certified holistic health coach from the Institute of Integrative Nutrition. She's a certified Food for Life Educator for Physicians Committee for Responsible Medicine. She has a plant-based nutrition certification from Cornell University, as well as many other certifications on healthy eating and plant-based cooking. Barb was a support group leader for the Las Vegas Neuropathy Support Group for 3 years. She's a frequent speaker on health and nutrition, and she's an active ambassador for the Foundation for Peripheral Neuropathy. And we welcome Barbara to talk about this very interesting and important subject. I'll send it over to you, Barb.
Good afternoon, everyone, and thank you so much, Nancy, Lindsay, and also Tanya for working the slides for me. I appreciate it very much. Looking forward to this afternoon. You can go to the next slide. Well, you know a little bit about me, so you can go to the next slide. I'll tell you a little bit about my journey. Before I do that, I want to give a disclaimer because this program is for educational purposes only. I am not a physician. I am a certified health coach, but please check with your doctor or a qualified healthcare provider before beginning any diet or lifestyle change or any supplements. You can also be tested by your physician on what supplements you might be needing. They can do that through a blood test. Next slide. I'll tell you a little bit about where I began. I'm not going to go through all of this. You heard a little bit. Again, I thought I was eating healthy. I ate pretty much the standard American diet, which is really a sad diet, and it was full of sugar and salt and greasy food and all the things that seemed to be what I grew up with as a child. Because of some of my health issues that I'll briefly go into, I started on a health journey and I became the health coach and a detox specialist, and you can see some of the things. A Food for Life instructor for the Physicians Committee for Responsible Medicine. It's a very intense program, but it taught me a lot, and that's why I'm hoping to pass this on to you. Next slide. I approached neuropathy with the same vigor as I did when I found out that I had a heart disease and had to have a stent put in, emergency. And when I started with neuropathy, it was around in 2010. I felt just a slight numbness in my toe. I thought it was from tight shoes. Did go to a podiatrist who said, you have neuropathy. Meant nothing to me at the time. I thought, well, if this is what this little tingling is, that's not a problem. But as I continued to study and to learn, and as my numbness and the pain started intensifying, I went to a neurologist and learned a little bit more, but it wasn't until I really delved into it myself and became a group leader in neuropathy here in Vegas that I learned even more. Next slide. While our nerve pain can't always be cured, it can be treated. There's lots of good options that are available. I'm going to just talk about one today, but there are so many things, and it's really a culmination of all of these things that's going to help improve. It's not just your diet, it's not just nutrition, exercise, meditation, good food, healthy thoughts, exercise, you name it. It's not just that, it is a culmination of all of those things that include pain medication and other types of medication. But there's a lot of good options that are available to us. We're not alone. Next slide. I'm going to discuss today our diet and nerve pain and how they actually work together. Some of the main triggers that teach that not all carbs are created equal. We're going to discuss some of the foods to avoid that are known to cause nerve damage, and some of the main nutrients that our body needs to improve neuropathy. We'll also talk about food supplements and food to help us support our nervous system. Next slide. So again, neuropathy can be improved or worsened depending on what we eat, because our body absorbs everything that we eat. So it's important to know what to eat and what to avoid in order to help stop this tingling, the numbness, the burning, and the pain from getting worse if possible. Next slide. Our nerves are protected by a myelin sheath. And if you can look at this picture, you can see a healthy nerve cell, and you can see how the myelin sheath is covering that nerve. When the nerve cell is damaged, now this one happens to be a picture of MS, but it can be any type of nerve damage. You can see that it's frayed and it's exposing more nerve, causing pain, numbness, tingling. Our nerves are constantly receiving information that there is pain going on or damage going on, even though there really isn't. But our nerves are picking up because they're not protected and they're not covered. So these pathways are no longer working. Next page. So again, our first line of defense is preventative medicine, or for preventative medicine is good nutrition. It's the same is true for our peripheral neuropathy. So I'm going to first look at the foods to avoid and that can trigger our pain. Next slide. One of the worst culprits when coming to pain triggers is going to be sugar. White sugar, high fructose corn syrup, at HFCS. If you see that on any products, if you're reading the labels, avoid those. They do cause nerve damage, and our cancer cells actually feed on sugar, and it releases inflammatory messengers. We'll talk a little bit more about inflammation later, but it's like having water on a stove with slow burning. It starts out fine, but it eventually gets warmer, warmer, and then hot. And that is basically what inflammation is in our body. We're going to talk a little bit later about seafood. Now, I'm not going to say that all seafood is bad, and we'll talk about that. But seafood does contain mercury, and high levels of mercury can damage nerves, can aggravate nerves, and it makes nerves much worse. We're going to talk a little bit about our refined carbohydrates. The word is refined, not carbohydrates themselves. So your refined carbohydrates are going to be like your white flour, your white bread, white rice, things that have actually had the good nutritions removed from the grains themselves. Carbs themselves, refined carbs, can actually increase our triglyceride levels and our blood sugar levels. But carbs themselves can actually be beneficial in that they will help to add nutrition to our body. So not all carbs are created equal. Other carbs can be fruits, grains, vegetables, even milk and dairy. Next slide. And I'm going to say small amounts of milk and dairy because it can also be inflammatory. I personally am a vegan. I know that a lot of people out there are not, so we're going to talk about both meat and fruits and vegetables. So some of the main pain triggers, again, continued here. Vitamin B6. This was something I was totally unaware of until my neurologist said, you have very high levels of B6. And I had no idea that was toxic to my nerves, and it can actually damage your nerves. High levels of B6 can cause damage, and low levels can cause damage. So this is where you want to go to your doctor and you want to have your vitamin levels checked, and they can check for these. Saturated fats. This is something that we all tend to kind of like to eat. They naturally occur in red meat and dairy, but they are not healthy for us because they're processed. A lot of the food would have, like red meat and your sausages, contain a lot of fat, and fat can trigger inflammation, which again is known to worsen not only nerves, but also joint pain. Animal foods. So you want to eat as many fresh and organic as possible. Some of the meat additives can cause inflammation. For instance, like your cattle, they are given injections of antibiotics to help them fight infection. And then, of course, that is passed on to us. Processed foods cause inflammation. Our bodies are really not designed to know how to process processed foods. Gluten, if you have celiac disease, which is an autoimmune condition, you'd want to avoid your wheat, barley, rye, oats, and there's other things, but this can also trigger inflammation and cause more pain and damage. Next slide. SAD, that's the standard American diet. Our pizzas, our fast foods, and these are the biggest culprits. If you think about what French fries soaked in grease is looking like as it's fried, and then we ingest that. Those again are your bad carbohydrates. It's going to cause high cholesterol. It's going to clog our arteries, which is going to be bad for our heart, also for cancer and other health problems. Trans fats, that's another type of fats. Those are usually found in your baked and your fried goods, but your vegetable oils as well. They cause inflammation and joint pain. Your creams, sugary snacks, butter, processed meat, red meats especially has it. So those high trans fats also would include your margarine and your shortening. Stress, not a food, but it definitely increases nerve pain. Probably most of us have noticed when we're under stress that we're not feeling as well, we're sluggish. You may even find that your feet are burning and hurting even more than normal. Doesn't have to be your feet. Neuropathy can be in a variety of places. Next page. So again, not all carbs are created equal. Some of our good carbs that we want, it could be your oats and your grains, some of your grains, your whole grains. Bananas are very healthy. Sweet potatoes, love sweet potatoes. Quinoa is very nutritious and it's very popular. If you haven't tried it, that may be a grain that you'll want to try. Fresh oranges, blueberries on top of your oats. Blueberries as a snack, blueberries in your salads. Again, your whole grains, buckwheat. Stick to low-fat dairy products if you can, and legumes, so your beans. They're very, very healthy. Next page. So some of the main nutrients that we need for neuropathy, and I'm going to go over several of them. I talked about our B vitamins because they actually support the functioning of our nervous system. So make sure your B vitamins are at the levels they should be. We talked a little bit about B6. It also helps to preserve nerve damage, and it helps to discourage inflammation. However, taking too high levels or too low of levels can actually cause nerve damage. B12 is a deficiency that can damage that myelin sheath. Again, if untreated, it can definitely cause nerve damage. If you are vegan like myself, you need to take a B12 supplement. We'll go over that a little bit further on as well. Next slide. Next slide. Thank you. So some additional nutrients that we need, vitamin C can actually help to repair and to prevent nerve damage. Again, you don't want to overtake your vitamins. Some are water soluble, so you take them, they go in your body and they go right out, but some do not, they build up and can actually be toxic. Vitamin D helps to decrease pain and to promote nerve growth. So foods with your vitamin C's and D's and the other vitamins that we've talked about, we'll go into in just a moment. Vitamin K, it is known to relieve idiopathic muscle cramps. Some people, if you have muscle cramps, in addition to it may be water that you need, it may be magnesium that you need, there could be other things, but it could also be some vitamin K. Again, check with your doctor. Next slide, please. Some nutrients needed that I take as well as some of the others. I take an alpha-lipoic acid. I take the RLA. The RLA is a natural form, whereas the ALA is more of a natural and a synthetic form. If you can get the RLA, you're better off. It will improve nerve function. It does help to relieve some nerve pain in the arms and legs. Many people take it for just that reason. It can help to protect against nerve damage and can even help to reduce your blood sugar levels. The RLA, again, is the one that I take because it is more natural, and that's what actually, it's native to our body. Vitamin E. Being deficient in vitamin E, again, can damage nerves. So as we can see, there's a lot of vitamins if we're missing them in our body, which comes from nutrients. They can cause nerve damage. Vitamin E helps to reduce pain and can support nerve regeneration. And in some cases, our nerves can regenerate. Again, that's for another topic. But some can, especially if you've checked your vitamins and you're low and you catch it early enough. Some things can be reversed. Magnesium, this is a great mineral that helps with your muscles. Some people have their toes and their hands that cramp and bend and curl up. So it will help with your muscle contractions, and it also helps to fight off pain. I'm going to talk a little bit about the omega-3 fatty acids. Omega-3 fatty acids support nerve regeneration. There is plant-based omega-3, which is actually better than fish oil. And I'm not saying that because I'm a vegan, but it's fresher. Sometimes the fish oil, by the time they've caught the fish and froze the fish or processed the fish, and then by the time we get the oil, it's not as strong, and in some cases can be rancid. If someone eats fish in order to get their omega-3s in their diet, you're kind of getting that secondhand fatty acids. However, there are some fish that can be very healthy. Some that have low levels of even mercury in them, which we talked a little bit about earlier, would be your salmon and sardines, cod, shrimp, oysters, crab, your canned light tuna. All of those are low in mercury levels. They also are high in essential fatty acids. High amounts of omega-6 can trigger inflammation. So again, this is where you want to check with your doctor. You want the omega-3s, you need some of the omega-6, but too much can cause inflammation, which inflammation, as we know, can cause a lot of, and triggers a lot of pain in our bodies. So you want to avoid fast foods, the bad carbohydrates, certain types of oils and fats. Again, your processed foods, stay away from those if you can. Next slide. Turmeric. This is something that I hadn't heard too much about until the last few years. It's a compound known as curcumin, which is a powerful anti-inflammatory. Careful with turmeric, it stains if you put it in your food processor, if you get it on your counter, you get in your hands and feet, or your hands, it's going to stain and it may not come out. But for neuropathy, it does help to relieve numbness, tingling, and pain in the hands and the feet. It needs to be taken with black pepper so that it can absorb better into the body. Capsaicin is an active compound found in many different types of hot peppers. So if you can eat your hot peppers, those are good. There's also capsicum creams that you can rub on, and they do help to reduce some of the tingling and pain in the extremities. And it doesn't have to come just from diabetic neuropathy. I put it on the cream sometimes at night, and it does help to reduce the pain. Next slide, please. The B complexes that we can eat. So here's how we're going to get some of this nourishment that we talked about in supplements. We want to eat it as fresh and whole as we can, better than a supplement because we're getting the full benefits. So for our B complexes, we want to eat green leafy vegetables. Sweet potatoes are a wonderful source, and you can put beans on top of them. There's a variety of ways that you can fix sweet potatoes. Bananas are very rich in vitamins and also C, E, and magnesium, potassium as well. Your B12, people ask, what is the best form of B12? It's the methylcobalamin, which is the best source to get. There's another source, but if you just remember BM, you'll be fine. And so look for your vitamin B12 with the BM, methylcobalamin. It's the most effective form. B12 is actually produced by a bacteria. So when people say, oh, vegans or anyone needs to eat animals to get their B12, that's not accurate because it's produced by bacteria that the animals eat and that the plants grow in. Animals, including humans, must obtain it directly or indirectly from bacteria, or you can take it from a supplement. Next slide, please. Vitamin B6, again, it's one you don't want to get too much of. It can cause nerve damage. Also, too little can cause nerve damage. But you're going to get it in your protein foods. You can get it in your meats. Again, I recommend organic meats. Whole wheat, salmon, that's one of the fish that you can eat that is low in mercury. Nuts are a great source. Wheat germ, brown rice. We want to be careful with the brown rice. We'll talk about that. Peas, beans, bananas, and jackfruit. If you haven't tried jackfruit, that may be something you want to look into. Vitamin C, your oranges, your grapefruit, your red and green peppers, kiwi, Swiss chard, and broccoli. These are just some. There are other sources. Your vitamin K, you're going to get them in your leafy greens. You'll notice most of your vitamins are going to come from your leafy greens, your nuts, your legumes, your good carbs. So kale and spinach, collard greens, broccoli, there's so many recipes that you can do with broccoli and Brussels sprouts. Parsley, avocados, that's a good healthy fat, and kiwi. And cooked leafy greens have about 5 to 10 times more vitamin K than raw greens. So salads are good, but if you're going to get your greens, you want to cook them for about 5 to 10 minutes. Vitamin K needs to be taken with the D supplement to help it, or eating foods with vitamin D to help with absorption. Next slide, please. Vitamin D. Here's your salmon, your tuna, halibut. Those are mostly low in mercury. Mercury damages nerves. So anyone that eats high volumes of fish or seafood, you're getting high volumes of mercury. And this can damage your nerves and cause to be much more painful. Vitamin E. Again, you can get this from your spinach, your broccoli, your sunflower seeds, almonds, mangoes, kiwis, and tomatoes. Very rich in your vitamin E. Next slide. So we're still talking about the lines of defense, which is good nutrition. Another way to get some vitamin C is your mangoes, watermelon, berries, citrus fruits, papaya, potatoes, even your white potatoes, better off with your sweet potatoes, peppers, tomatoes. Remember, your peppers are going to help with your pain as well. Vitamin D, this is very important. Lack of vitamin D has also been shown to be a problem with memory and depression. So we want to make sure we get sunlight. It's the best way to get your vitamin D. Besides your berries, pineapple, oranges. Again, here's your sweet potatoes, pumpkins, avocados, some fatty fish. Again, we want to be careful. Your eggs and your mushrooms. ALA, and again, I take the RLA, which is a grass-fed meat. That's the best kind if you're going to eat meat. Broccoli, brewer's yeast is good. Spinach, Brussels sprouts, and nuts, and especially walnuts. Walnuts are also good for your memory. Omega-3 essential fatty acids. You're going to get that from flax seeds, chia seeds, some fish, your better fish, walnuts, tofu, navy beans, There's Brussels sprouts and avocados again, and from farm-fed, grass-fed animals, pastured eggs, meats, and some dairy products. Very little on the dairy. Next slide. Again, because milk and dairy, those can actually cause inflammation. Some of it is okay, but if you drink a lot of milk, eat a lot of dairy, and you're having pain, you may want to keep a food diary and write down what you eat, breakfast, lunch, and dinner, and snacks, and do that for a few days and see if your inflammation or your pain goes up or down, and then check with what you're eating. It's a very good way to check your food. Vitamin E, we're going to get that from nuts and seeds, fruits, vegetables, red bell peppers, asparagus, mangoes, avocados, spinach, broccoli again, almonds, kiwi fruit, and tomatoes. Magnesium, again, all of these are good to help not only support your nervous system, but to keep from damaging the nerve, the myelin sheath, and to help with pain. Magnesium is found in your spinach, and actually almonds have a higher magnesium count than even spinach. Cashews, green vegetables, whole grain cereals, nuts, beans, and seafood. I added water here because staying hydrated helps to support the nervous system. 60% of joint cartilage is made from water. I think it's 70% of our lungs, it may be higher than that, has water. Water reduces inflammation. If you're having cramping, you get dizzy, try drinking more water, at least 8 glasses a day, and if you can, drink half of your body weight in ounces a day. That can be a lot, because a person that weighs 100 pounds, half of that would be 50 ounces of water a day. So that just shows you how much we need. If you stay hydrated with 6 to 8 glasses, that's good too. And you're going to see a difference in your cramping. I've had some of my members in my neuropathy group that when I mentioned water, they drank it. The next month they came back, several of them mentioned how much pain had been reduced simply by adding water. Now, if we do all of these things, it's going to improve even more. So that's just some of the ways. Next slide, please. So in a nutshell, nutrients play such a major part in our nerve repair and regeneration. Remember that our body absorbs what we eat. If we are eating nutritious foods, healthy foods, our body is going to react one way. If we're eating a lot of processed foods, a lot of fried foods, greasy foods, donuts, chips, things of that sort, our body is also absorbing those, and our cells need nutrients in order to repair and regenerate. So establish your diet around as many vegetables, fruits, and whole grains and legumes, omega-3 rich foods, lean proteins to support your healthy body. If your extremity numbness is severe, focus on anti-inflammatory foods, which are almost all of the foods that we mentioned. There are some that are more anti-inflammatory than others, but all of these will help with inflammation and pain. Try to even keep some pre-cut, ready-to-eat fruits and vegetables in your refrigerator. Then you can just go and mix up a salad, make up a snack. I do what I call salads in a jar, and I'll make up 5 or 6 jars of just a variety of salads, put it in the refrigerator, and I can have a salad every day and saves a lot of time. Next slide, please. So again, looking out for our health through proper nutrition and supplementation should not be ignored. Again, this is only a partial list of nutrients, But if you wrote these down or if you remembered them, this is enough for you to get started on. When you're working with your doctor, be sure to test for these nutritional deficiencies. And you may find that you can actually reverse, or in some cases, at least lowers your pain levels and the damage being done to our nerves. Next slide. Next slide. Thank you. So I want to thank everyone for coming. I know it took time out of your afternoon. I hope this has been beneficial and helpful. This is just a quick overview, but if we take care of our bodies will help take care of us. And don't forget, like exercise and quiet times and good food, following up with your doctor, your medications, all of the things that we need. Stretching is wonderful, your water and your nutrients. So thank you again, everyone, for coming. And I know we're going to have a Q&A answer, I believe. So let's see how we're going to do this.
Hi, everyone. My name is Nancy. You heard me speaking before, and now you see my face. And Barb, I've got many questions for you, so let's get started. The first question that a lot of people asked, how much do we need of one supplement versus another? Can you address, I know it's going to be different for each person, how does somebody even find out how much they need of a certain supplement or what supplements they need? What should they ask their doctor and what should they expect?
Well, the first thing that I would do is talk with your doctor. You're going to hear me say that probably for most of these things because, like you said, Nancy, each body is different. However, the Institute of Medicine usually recommends that we consume about 0.83 grams of protein for our body weight per day. This amounts to about 56 grams a day. The average male, I think, is about 46 grams. I'm not a nutritionist, so these are things, again, you're going to want to check with your doctor. A woman has a little bit less, but if you're eating a variety of fruits and vegetables, and we should have, this sounds like a lot, and I don't do it myself, but I'm working on it. We should have about 6 servings of greens a day. What I have started doing is going to Costco and buying that big container that has a variety of greens, because we don't want to eat just spinach, because that's only a few sources of nutrients. But you may want to try your arugula, and there's other kinds of beets, different foods like that, the beet leaves, things like that that are green. You're going to get a different variety of nutrients. So try to keep that in there. Go into your refrigerator, grab a little handful, and just sit there and munch kind of like a rabbit. And just think of what you're doing for your body. Don't think of it as looking at it for a diet. Don't think of it as having to do anything but feeding your cells. When I look at good food, I think that's feeding a cell. Maybe it's feeding my nerve cells. And I've had neuropathy since 2010. That's when it first started. It started getting worse probably about 5 years ago. And it started getting a little bit more progressive, I would say, the last year or two. I really attribute my mental health that I try to work on. Everybody's under stress, and I'm, not immune to that. I try to eat healthy and I try to exercise. And I really think that this has helped to slow up. It's probably not going to reverse it, but I do believe it's helped slow up my neuropathy. And staying mentally active, very important. If you can't do physical, if you're laying in bed, just move your arms. You've got to move what we call our lymphatic system. That's all those toxins. The only way those toxins move is when we move. Lymphatic system doesn't pound like a heart does. It just sits there and builds up. That's why sometimes our lymph nodes get
Yeah,
Little
thank you.
sidebar with that.
Yes. So, in terms of oils and fats, are there certain oils and fats that are better for us? Somebody asked about coconut oil. Someone asked about which fats are high in omega-6. Are there things that we should be adding to our diets and things we should more likely try to avoid?
That's an excellent question. Um, there's trans fats, there's saturated fats, there's unsaturated fats, and it's like, where do we go with this? I can relate to that because when I first started studying health and nutrition on a very serious basis, that was in 2011, I looked at that and was confused. Our trans fats are not good. They are like your baked goods, your fried goods. You think of, which we all like, our donuts, we think of French fries. And you think of when they take a donut or the French fries and they dip it in oil, we are absorbing, or when we eat that, we're absorbing that oil because not all of it drips off. So it goes into our blood system. It clogs our arteries and it causes cancer. Diet can actually be related to cancer, heart disease. So it's not just neuropathy.
Yeah.
Your unsaturated fats, I guess if you're going to eat any, that's the best to have. Avocados are unsaturated fats, but that's a healthy fat. You wouldn't want to eat like 2 or 3 a day, but to have several a week is not going to hurt at all, and it gives you good fat and nice plump for your body and your skin. Some of your olive oil, I'm leaning more and more towards no oil, and only because everything is processed. Now I'm finding that a little bit difficult. I am a little bit more extreme than maybe some of our viewers out there. But if you're wanting to really focus on it, stay away from oil of any kind, except your healthy fats. I cook, just FYI, I cook with vegetable broth. I can saute my onions, I can saute my vegetables, I can do a lot of things. Now, if I want to brown something, I'll take a little bit of oil and put it on the top. But again, I'm going to use my unsaturated.
Great, that's very helpful. What about sprouts? Are there some sprouts that are healthier than others?
Sprouts of almost any kind. There's some that are better than others. I used to grow my own sprouts. I haven't done that recently. But if you can buy healthy sprouts, there's alfalfa sprouts, there's bean sprouts, there's all kinds. I would just get them and put them on your salads, put them in your sandwiches. You're having your white tuna, let's say. I don't. I have a tuna-less salad made from chickpeas. Tastes wonderful. But I put bean sprouts on that, or any kind of sprouts that I can. So yes, sprouts of any kind. Put them in your refrigerator, munch on them with your lettuce.
Great. And what about potatoes? You mentioned sweet potatoes. How about white potatoes? Are they a good starch, a bad starch?
Okay, that's a good question. Actually, potatoes, they're a vegetable. They're grown in the ground. They by themselves are not that harmful. It's what we put on them. It's when we add the butter and we add the cream cheese and we add the bacon bits, and I don't even know what else you add anymore. That's when it becomes bad. Now, my butter that I use, I can think of the brand, but I'm not going to say it. But it is a vegan type and tastes just like butter. And it gives you that nice kind of melting in your mouth flavor that you get from a potato. You can make your own sour cream. I mean, you can get into all kinds of things, or just buy a good, maybe low fat if you can. Put it on. I'm not going to suggest that everybody become vegan or vegetarian. It is the most helpful way to eat, however.
Great. Thank you. That is helpful. What about condiments?
What about them?
Are they to be avoided? Are they
Well,
things that
you know, again,
yeah.
okay, I'm going to try to answer that as I think you're asking, or your viewer is asking. Let's take mayonnaise, for instance. Again, it's going to come from dairy. I'm pretty much against dairy because of the inflammation and the way it can, the cholesterol level and clogging your arteries and a variety of other reasons. But there are fat-free, there are vegan mayonnaise. Mustard is fine. What else? Ketchup has a lot of sodium in it, so you want to be very careful with that. Let me think. What else would a condiment be? Pickles. I think pickles are great. I use the pickle juice when I'm making my tunaless salad sandwich. So I think condiments are fine. I don't know if salt's considered a condiment, but very little salt. I use more pepper. Whenever you can use herbs, they give such a great flavor.
Yeah, yeah. Herbs and spices are the best way to
Herbs
go.
and spices, yes.
Yep. And then somebody asked about the nightshades, tomatoes, eggplants, peppers. There's mixed feelings about those.
There is mixed feelings about that, and I have studied that some. I'm not going to say I've studied a lot because I love tomatoes, I love mushrooms, and I eat them. However, some people find that the nightshades do cause them problems, and they are not healthy for them. I'm going to kind of stick with the training that I've had, that whatever your body is feeling is good for it, go ahead and try it. Unless it's candy, sugars, carbs, things of that nature. I'm not talking about your bad foods. I'm talking about healthy, nutritious foods.
Right, right. And there were a few questions about something that the alpha omega-3 supplements. Do you know anything about that?
Yeah, the ALA, the essential fatty acids, or the ALA, alpha
It said
lipoic acid.
algae
Okay,
omega-3.
okay. The alpha lipoic acids, there's two forms. There is the natural form, which is the RLA, and then there is the natural and synthetic form, which is the ALA. Now, I recommend alpha lipoic acids. I take the RLA. Mostly I take it for pain because it does help with inflammation and with pain. But again, I take the RLA versus the natural synthetic form.
Okay, all right. And we know, alcohol is high in sugar, but what is the feeling about having a glass of wine every now and again?
I think if it doesn't harm you and it's not hurting you, you're not feeling a lot of pain, then I think it's fine. I find that I don't even have a glass a night. There's nothing wrong with it unless it's causing you pain. If you're not, it turns to sugar, and sugar affects our nerves. It doesn't just affect it, it damages our nerves. Cancer cells feed on sugar. So sugar is just such a nasty, nasty, it's not even a food, an ingredient, I guess.
Yeah, an element, however we want to call it.
An element, yes, yes.
Yes. What do you feel, or what have you learned in your studies about fasting? Is that something that is good for people or not so good?
Great question. A lot of great questions today, Nancy. Fasting can be good because it can take the toxins out of our body. Now, there's also the belief, of which I used to firmly hold, that our bodies detoxifies itself. However, with our environment, with everything that's floating around in the air, with all the toxins that we are breathing in that is grown in our soil, that even our cleaning products, we get a lot of toxins. Some of these toxins stay in our body. So sometimes we need a little help. And there are detox diets. There is fasting that you can do. And I do believe it helps. Yes.
Right. We've had a couple of people who are vegans or vegetarians, and they're wondering what should they watch out for? What supplements should they be taking? Where should they be getting their protein? And this is going to be a multi-part question.
Okay.
Ask that first, and then the second, for people who might want to step in that direction, what do they do?
Okay. Actually, that's not a real hard question. It just can be a lengthy and perhaps a more involved question. So I'm going to answer the first one. Where do you get your protein? For one, if you're going to be vegan and vegetarian, what supplements should you take? You saw the list of the supplements that I talked about. Those are kind of the top, I think there were 10. Those are kind of the top 10 that as a vegan or as a human, we should take. There are others, but I just focused on maybe the top 10. There's probably about 20. But for time's sake, I just selected the ones that work not only, or that help, not only in general for the general population, but for people with neuropathy. Having said that, people will always say, well, where do you get your protein? We get wheat, being vegan, and almost plant-based, which means very little processed. I'm not 100%, but I'm pretty close. You get a lot of protein from your nuts and your seeds and your leafy greens and your vegetables. If we eat those on a consistent basis daily, you're going to have your protein. Now, there are supplements that you can take. I highly recommend a multivitamin. If you are like I was, high in B6, it's almost impossible, or it was difficult for me. I just quit taking a multivitamin, so my B6 levels became in the normal range. So watch the B6. B12 is one that we need. It's water soluble, so when we ingest it or we take it, it's not all going to stay in our bodies. Some vitamins stay in our bodies and they just build up and they can become toxic because we don't release them under normal body function.
Work with your doctor to see.
Absolutely.
Get that recommendation.
You know, this is something that as neuropathy patients, we need to stay on top of our doctors. They may not recommend it. They may not suggest it. I mean, they may recommend it. They may not suggest that we have blood tests. I get one about every 6 months, maybe at least every year, but usually every 6 months I'll get blood tests and I'll have my triglycerides tested, all the heart things that you have tested, but I also have my supplements tested, my B levels, B6, B12, vitamin D, all of those that are important, and then I take supplements as well. CoQ10, if you have heart problems, or for anyone, CoQ10 is important.
Great. And then as the final question for a takeaway for everybody listening, what would you say made the biggest impact for you as a peripheral neuropathy patient and was the biggest difference that helped you in your diet?
Okay. In my diet or just in my knowledge of what this disease is?
I would say if you were to recommend one thing to people, if they were to take away to do after this presentation.
Education. Go to your website, go to the Foundation for Peripheral Neuropathy. This was not something that was planned. Go to that foundation, look at it, read it, absorb it, talk to your doctor. You take the active part in your doctor. How many times do we go to our doctor and we come out and we think, well, what did I learn? What's different? Go in with a list of questions. Once you have looked at the Foundation for Peripheral Neuropathy, that's one. Once you've read some books, I've got a couple that are really good that I just absorbed. then you know what to ask your doctor. What kind of neuropathy do I have? What's my blood like? What are my vitamins like? Education, education, education.
Perfect. Well, thank you for that, Barb. Thank you for your time. Thank you for all that good information. We have many questions that we didn't get to. I apologize, but we'll get the presentation around to people, and I thank you for your time.
You're welcome, and thank everyone for joining, and thank you, Nancy, and thank you, Foundation. I appreciate it.
Great. So I again thank everyone. If Barbara gave a great plug for us, I'm not sure I need to, but if you like this webinar, please let us know. We'll have a survey that will be coming up for you to give us your views on it. To continue to support us, we appreciate that. It's how we continue to do these type of programs, and we have programs once a month for the next few months. And if we can help you with anything else, if you've got any questions, feel free to reach out to us. We're here for you. So again, thank you everyone for joining us, and thank you for a terrific afternoon. Bye, Barb. Bye, everybody.